Dr. Grindstaff, we talked a little bit about how orthotics help with, normal everyday kind of heel spur pain sometimes, and with just arch pain, people standing along. Now, orthotics, from what I know, help for a whole host of other things. Can you kind of like name us all the things orthotics are good for? Because there's not one reason alone to wear orthotics, is there?
No, there's many reasons why people wear orthotics. Some of the other reasons are many times people have pain under the ball of their foot. There can be a callus there. There can be sometimes no callus, but it still hurts in that area. And so an orthotic will take and distribute weight off of the ball of the foot and frequently relieve pain under that area. Another thing that orthotics are commonly used for is for people that have early deformities, such as early bunions or early hammer toes, and it's felt that orthotics help to slow the progress of these deformities and may actually, in some cases, be able to prevent these deformities from progressing further. There are other people that wear orthotics. One of the most common groups of people that wear orthotics are diabetic patients.
Really?
As a matter of fact, the Medicare pays for one pair of diabetic shoes with custom insoles per year for every Medicare patient in the country that has foot problems associated with their diabetes. So we take molds of their feet, and we have a special made insole or orthotic made for the diabetics, and these oftentimes are very soft and cushiony, because frequently diabetics have neuropathy, which means numbness in their feet and burning and pain, and the cushioned orthotic helps that feel better, but it also prevents excessive rubbing and the formation of ulcerations and wounds in their feet. And so this is another very important thing that orthotics are used for.
I can see now. I can see now. I haven't never heard about that before. Very, very interesting.
Yeah, I mean, the sad part about that is that many people go to places to get diabetic shoes, and they obtain over-the-counter insoles from these places, and they don't get the custom type of insole that they should be wearing, and so they lose a lot of the benefit of getting the getting the diabetic shoe because of that.
Interesting, very interesting. Very interesting for people to know. What else? What else does orthotic help out with?
Well, certainly with children, it's a very common thing to use orthotics. Many of these kids have flat feet, and in a flexible type flat foot, oftentimes orthotics are used as not only for pain relief, but also to help the foot to grow in a normal fashion so that they don't need surgery on that foot. So it's used as a preventative measure for people with children with flat feet very frequently. And of course, with children, you have to change the orthotic.
Let me ask you something. I wanted to ask that. I mean, the unfortunate part probably is that that can, to a degree, get a little bit expensive, because every couple of years, or I don't know, they grow out of it, right?
That's exactly right. It takes about between 1 to 2 years for most children to grow out of an orthotic, and so every year or two, a new one needs to be made for children that have this type of problem.